Hello and welcome to episode 96 of the Pet Behaviour Chat. And today I wanted to chat a little bit about the Veterinary Behaviour First Aid Kit, because I think sometimes it can be really difficult to know what exactly we can send our patients and clients away with, kind of as a sort of an initial giving them something to do that will make the situation better and especially safer in the first instance. I think that's oftentimes clients will come to us for behavioral help. We might not be quite sure what to do, or we might be waiting on referral. You know, we know that veterinary behaviorists are usually in quite high demand, and you might not be able to get an appointment with a veterinary behaviorist for a while. So I want to chat you through 4 things that you can immediately do for your clients and your patients to help them out behaviorally in the first instance. Now, you may absolutely still be seeking referral. You may absolutely still be kind of looking to sort of create that kind of collaborative team that is going to help this pet with their behavior presentations. But we want to at least be able to advise something in the first instance that's going to make a big difference, that's going to keep everyone safer, that's going to help quickly, and that we can actually feel that we've supported our clients and our patients in some way. Now, some of you may be familiar with this. If you attended my masterclass on, designing beautiful veterinary behavior treatment plans, then you may well be familiar with some of the elements in here. If you are not, or if you didn't attend that masterclass, I'm just going to tell you what I'm basing this on. And I'm basing this on our 7M, the letter M, 7M approach to building beautiful veterinary behavior treatment plans. And we're going to just pick out 4 of the 7 M's, which are going to be things that you can very quickly implement. Now, in next week's podcast episode, I'm going to be going through the things that you want to think about if you're doing a bit of a risk assessment. So if your patient comes to you and or your client comes to you and they're presenting you with, a behavioral problem, you want to be able to assess risk quite quickly. So risk for the people involved, but also risk to the animal themselves, whether they are, self-harming or showing self-injurious behaviors, or whether they're perhaps putting themselves at risk of being relinquished or even euthanized. We're going to chat through a risk assessment in the next episode, and you'll probably want to do a little bit of a risk assessment, and that's going to influence how you're going to set up this veterinary behavior first aid kit. And I'm going to give you the elements that you can use to do that today. Okay, so here we go. As I mentioned, we're going to use 4 of our 7 M's that we can immediately look through. So the first one is going to be our medical, so our physical medical rule-ins / rule-outs. So when we have behavioral presentations, we always want to make sure that we haven't got, or we want to know whether we've got a physical medical component to this. And there are a few that are really sort of high on my list. Pain, whether acute or chronic, would be definitely something to think about. And this is oftentimes, if we have an older patient that's presented to us that have sudden onset of behavioral changes. So let's say perhaps an older dog who suddenly has started reacting aggressively, or maybe we have a patient with a known behavioral history that's been super stable, super well controlled, everything's been managed really well, and all of a sudden there's a deterioration in their behavioral signs. Those would be 2 of the ones where I'd have a big red flag that would definitely alert me to, I need to go looking for physical health contributors. However, we might have physical health contributors at any time. So we want to be looking for pain. And we know now that osteoarthritis is not an old dog disease. So even in a younger dog that's presenting for behavioral signs, we always need to be looking for signs of pain, chronic pain, osteoarthritis associated pain, but also things like dental pain. Do we have skin irritation, discomfort? Have we got like a really nasty otitis? So we've got ear pain. Do we have maybe discomfort coming from GI disease? So what are potential physical health contributors? So pain and discomfort are big ones. Then neurological disease would be something that I would be looking for. So, performing a really good neuro exam and looking, do we have any indication that we might have a neurological abnormality. So that's another one. Then I would be looking for, as I mentioned just now, any signs of GI disease. So have we got increased or abnormal GI signs? So vomiting, inappetence, diarrhea, flatulence, increased appetite. So either decreased or increased appetite would alert me to maybe something going on. Weight loss, right? So weight loss could be GI disease, could be any other kind of systemic disease as well. But GI discomfort is a big one. So, asking the client about the patient's stool, maybe giving them a fecal scoring chart to see, what does their stool actually look like and how many times a day does their pet defecate. Now, again, that could go in either direction, right? That could be a number of times per day. It could also be once every 3 days. So looking for any sort of signs of abnormality of the GI tract. So we've had pain, we've had neurology, we've had the GI tract, skin. That would be my fourth big one. So, do we have pruritus? Do we have indications perhaps of atopic dermatitis? Do we have flea allergic dermatitis in dogs and cats? Do we have any other signs of maybe parasitic skin disease? So skin is such a big one to be looking out for, especially if we've got, for example, a cat being presented for over-grooming, right? We want to absolutely make sure we're ruling out food hypersensitivities, anything that could be pointing us towards skin disease. So that would be my other big one. So again, we've got pain, we've got neurology, we've got GI, we've got skin. Those would be my big four ones. And then literally anything else. Other signs for systemic disease, endocrine disease, hepatic disease, kidney disease, urogenital disease. So any of the other organ systems that could potentially be involved with behavioral presentations. And those behavioral presentations could be wide, right? Like, let's say, for example, you have a dog that's being presented for house soiling. There are so many of those physical contributors that you might be looking for. Is the dog PUPD? Do we have endocrine or systemic disease? Do we have urinary tract disease or urogenital disease? Do we have perhaps pain and the dog can't get into either can't get outside, maybe if, let's say, they need to navigate stairs, or maybe they're struggling to get into a position to defecate, right? So again, we've got lots and lots of different things that we could be looking for there. Maybe cognitive dysfunction, is that behavioral or is it medical? It's probably sits somewhere in between. So medical rule-ins, outs, assessments, diving deep, looking for what other sort of medical, physical health you could be kind of looking for. That would be my first big point. So that's the number one M. And this might be, let's say your patient is being presented today. Let's say it's a dog that's all of a sudden started showing aggressive behaviors. You could do a lot of those examinations there and then, or you could, bring them back for further diagnostics. So, pain evaluation. So that would be my first one as part of my behavioral first aid kit, is looking at physical disease. Number two is management. So that's my second M. And here I'm really thinking about safety management. So we've maybe performed our risk assessment, which I'm going to go over in next week's episode, but we might want to absolutely be giving them some safety management pieces. So that could be baby gates, that could be wearing a muzzle or muzzle training, that could be, supervising all interactions between that pet and a certain maybe vulnerable group of people. That could be a safety management piece that is to do with crates or crate training. How do we provide safe spaces? That might be not taking them to certain places if that's high risk. Let's say, they've shown aggressive behaviors during a training session. Obviously, we want to dive deep into that, but that might be not taking them or not exposing them to triggers that are going to cause them to feel a certain way and perhaps react defensively. So safety management is a first big piece. The other big piece around the management is avoidance, right? So if your dog only does something, or if the patient only does something in a certain context, then avoid that context. So if they only react aggressively when they're lying on their bed and somebody approaches them to pet them, then just stop doing that. Absolutely, we need to dive deeper. But avoidance is a really big piece. And funnily enough, avoidance can be so difficult for many caregivers to kind of get their heads around, because I think in a lot of people's minds, exposing them to things in order to get them desensitized or habituated to something is a really appealing concept. However, we want to be avoiding things because in our minds, we know that by continuing to expose them to these certain triggers or things that cause them to react in a certain way, we're actually sensitizing them, not desensitizing. And we're actually strengthening neural connections around that behavior. And it's going to be even harder to undo those neural connections the more the pet has a chance to practice them. So if your dog barks at the postman every time the postman comes in, we need to try and manage that situation through avoidance. So we either need to keep the dog maybe at the back of the house or taking them out for a walk whilst the postman comes, because every time they show that reactivity to the postman, we're reinforcing behaviors and we're reinforcing neural pathways connected to those behaviors. And we're not actually habituating or making things better, we're making things worse. So that's another thing that goes in with management. A third thing that I would think about when I'm thinking about management would be something like creating safe spaces for the animal in that home. So again, that's a little bit maybe similar to safety management, but providing safe spaces creates places that the dog can go to or the cat to decompress. So all of those bits and pieces I would include in management, but for sure safety management and just preventing the repetition of behaviors. Those, if all the advice you give to those clients are those two things, that's already going to be brilliant. The third M that we can tackle in our behavioral first aid kit piece is meeting needs and potentially enrichment. So how can we meet behavioral needs in a way that's going to be safe for everybody and that's going to hopefully decompress that animal's behavior? And sleep is such an important one here. Can we ensure that that dog or that cat gets at least 12 to 16 hours of sleep? Now, that might not be, immediately possible, but we can think about sleep hygiene. Are we creating zones or spaces for that animal to be able to sleep and rest? We know if the animal doesn't get great sleep, we're going to have more emotional arousal. Have a listen back to episode 87, where I talk to Carrie Tooley about sleep. So sleep is one of the big ones here. Exercise. Is that patient getting the right kind of exercise in the right kind of context? And that could mean we might not be going out for walks if walks are really triggering, or if there are lots of things on that walk that are triggering, or we might be shifting walks to, maybe an off-leash area that's super quiet at certain parts of the day. So how are we optimizing that pet's exercise? Now, if we've got pain, we need to be really kind of structured about giving exercise advice. So, what does that look like? Is the dog maybe not getting enough exercise? If we've got a large breed dog and, they're at home all day because their owners are working and they don't really get any exercise, what can be done to build that into meeting their behavioral needs? So sleep and exercise. And then the other thing is environmental enrichment and stimulation in terms of meeting species-specific needs. So if you have a Labrador and that you're not giving them any opportunity to perform oral behaviors, whether that's chewing on something or licking something or picking something up with their mouths, then we need to change that. If you've got a terrier and we're not providing opportunity for them to maybe be able to dig or shred things or rip things up in order to meet those species and breed specific behaviors, we need to do something about that. So how can we think about providing what the dog needs from a species and breed perspective? And then for cats, obviously it's meeting those 5 pillars of a healthy feline environment. And I have an episode in this podcast all about that as well. So meeting those species specific needs is a really important piece. So that's my third M. And then finally, my fourth M would be medications, pheromones, and supplements. And I guess if we're thinking about providing behavioral first aid, we're probably looking in the realms of short-acting psychopharmaceutical agents that might be able to help. So if we have a patient that has just experienced a significant trauma, let's say a dog's gone out on a walk and has been attacked by a big dog, do we need to think about managing that trauma, that behavioral experience in the immediate instance? And are we thinking about something like a benzodiazepine, for example? Are we thinking about long-term medications, but we want to or need to provide a short-term medication to bridge that gap until the long-term meds start working? So there we might be thinking about trazodone or gabapentin. Are we trying to provide behavioral first aid for specific contexts such as fireworks or thunderstorms? There we might be thinking about Cilio, maybe Pexion, maybe one of the other short-acting medications, depending on that individual's response. So we could also be thinking about trazodone or a benzodiazepine, although obviously we have some alpha-2s which are licensed for that. Alpha-2s like Cilio, but also Pexion is licensed for that, right? So we want to be thinking about some of our short-acting medications. Do we want to be providing behavioral first aid for the context of coming to the veterinary clinic? So there, again, we've got a licensed product for cats, which is pregabalin. So that's a product called Boncat. Do we need to be managing a short-term separation from the client where we could use tazipimidine or Tessie, right? So we're thinking about some of these short-acting event medications to provide a behavioral first aid platform. Pheromones and supplements could potentially also be useful here, right? So maybe as part of that management piece, we could be recommending pheromones at home, whether that's a Feliway plugin or an Adaptil plugin or any of the new pheromone products that are on the market, for example, by Verbac or by Signs. So, could we be providing that? And then supplements might be a good alternative to a psychopharmaceutical if either you're not comfortable with psychopharmaceuticals or maybe the client isn't comfortable with psychopharmaceuticals. For example, some of my favorites would be an alpha-casozepine containing product such as Zilkine, or an L-theanine containing product such as Angzitane, or maybe a combination product such as Soliquin or Carmex. So Carmex is made by Vet Plus. So are there some supplements that we can perhaps think about? Now, supplements could be used in conjunction with a short-acting psychopharmaceutical or as a sole agent, but I would urge you to always think about what is the effect that a pheromone or a supplement can have versus the level of fear, anxiety, stress, arousal, panic, whatever it is that pet's experiencing in that moment. And if we have high levels of any of those sort of emotional behavioral presentations, are we going to be able to reach that level of intensity with our pheromones and supplements, or do we need a psychopharmaceutical? So those are some of the things that we can think about. And it's actually quite a lot. If you think about it, that's a lot that you can already provide to clients, right? You can absolutely do all the medical stuff. You can give advice on management. And remember, I said, if all you do is give safety management advice and perhaps avoiding triggers and maybe, making some adjustments in the home, that's probably already going to be amazing. Meeting needs, sleep, exercise, and then providing either the 5 pillars of a healthy feline environment for cats or, some canine and breed specific activities for that particular individual. And then finally, our medications, pheromones, and supplements. So if you want to learn more about short-acting psychopharmaceutical medications, then Psychoactive is the course for you. If you're unsure about some of that, and if you'd like some more information about the pheromones and the supplements, you'll find all of that in my Psychoactive course, and I'm going to put the link in the show notes. So really excitingly, we also have a payment plan option now for Psychoactive. So if it's something that you can't pay in one hit, you can pay over 6 months. And also we have some amazing upgrade options for Psychoactive. So you can now get access to Psychoactive Gold and Psychoactive Platinum. If you want more details on that, just click the link in the show notes and you can read through at your leisure what all of those options entail. The other thing that you might find really helpful if you want to give some veterinary behavior first aid advice is my client handouts ebook. So it's an ebook that contains currently 55 pages, but it's always growing, with 18 separate handouts, 10 canine, 5 feline, 3 general. And a lot of what I've spoken about in here, like the enrichment, like the 5 pillars of a healthy feline environment, there are handouts for all of those things in my ebook. So the ebook could be another really great sort of behavioral first aid tool that you can utilize to give to your caregivers to support your patients. So I'm going to put the links to both Psychoactive and also to my ebook in the show notes. Have a look at those and see whether they might be good resources for you. And so there's a lot you can do in the first instance while you're waiting to refer, in order to at least be able to do something to, create that client relationship, to bond that client even more closely to your practice, and obviously to be able to provide much needed help, support, resources, services in that first instance. So I hope you found that useful. I hope you feel a bit more confident now about providing sort of first aid resources. And again, have a look at the links to Psychoactive and to the ebook, the Client Handouts ebook, and hopefully there'll be lots of support there for you so that you can feel more confident and comfortable in advising these clients that have pets with behavioral presentations that desperately need your help. All right, I will see you all next week for the risk assessment piece. Bye for now.